cardiovascular surgery. I hope that you have get some information regarding the cardiac surgery and vascular surgery. This is very important for your future career to deal with this problem, either in practical or in your academic future and your progress. Bismillah ar-Rahman ar-Rahim. Let me start this. To complete our subject, we start the first one about the acute arterial disease and peripheral one. Today we'll discuss what we have a chronic arterial disease, what we call it obstructive arterial disease. What is the obstructive arterial disease, a chronic one? This is commonly caused by two things. The more common, atherosclerosis, and second one, arthritis. The atherosclerosis is the more common. It is affected all the ages, but it is a progress in the when you are getting older, especially in diabetic patient, especially in hypertensive patient, in obese patient, or in smoker or alcoholic consumption. It will be decreased the atherosclerosis, especially if this one it is an alert, not athletic, have no an exercise. This is increase the problem of atherosclerotic changes in the artery. Now, what is the sign and symptoms of the lower limb arterial stenosis or occlusion? First of all, you should have to take an history from the patient about the intermittent claudication. What is the meaning of intermittent claudication? Mean the painful muscles spasm occur when you have and do an exercise. There is a two things you should put it in your mind about the intermittent claudication. First of all, you should be discuss the distance that he can walk this patient and he start the pain. Maybe have 1 block or 2 block start the pain, and the time to relieve of that pain. It take how many minutes or seconds to relieve that pain and to continue the same exercise or the same walking to get pain in that one. This is it will be have the severity of the problem. When there is a short distance, he severe a pain, and he need a long period to relieve the pain. This is a severe arterial occlusion disease. But when the distance it is a longer to get a pain and have a shorter period to relieve this pain, this is have a mild stenotic of the artery. Two things you should put it in your mind. I repeat it. The distance that the walk, how many block to get a pain, and second one, the time to relieve this pain. Second one, we have a rest pain, at this patient, he have a severe pain at night. When he get no exercise, he have a severe pain. And beside that, have a coldness of the limb and color change. Maybe color start from the pallor to the blanch and to dusky color start. And it will become ulceration, especially in the tips of the toes, and start to gangrene or pre-gangrenous one. The temperature, it will be different between the healthy part and an affected part of the obstructed artery. And the sensation of movement, it will have a severe pain. And the movement, when it is more severe, lead to have a paralysis and unable to movement. If you remember in the last lecture, the 6 P's, it's very important to remember it as you remember your name. And beside that, the arterial pulsation will be either a weak or maybe an absent. Also, you have an arterial bruit. This is when you put a stethoscope, you hear a bruit, especially when you have aneurysmal or post a stenotic dilatation, or maybe have an AV fistula. And the second one, during your examination, it is very important to do a venous refilling and capillary filling with Harvey signs. Harvey sign, this is to how to empty the vein, and rapid return back of the filling. The time of refilling should be not take than more than 1 second to 2 seconds. If it is anything more than 3 seconds, mean there is an abnormal in the arterial size, either stenotic or obstruction. The most important, the time to relieve of that venous filling and venous refilling and capillary filling. The most important, the normal one, it return back in 1 to 3 seconds. Above 3 seconds, it is an abnormal venous refilling or capillary filling. The Harvey signs, this is how to do, how to empty the vein, the vein, and how it will be returned back of this vein. It is depend on the arterial flow, how much it is obstructed to that part of the body. The impotence, especially in the male, not in the female, the impotence will have abdominal, aortic, and iliac disease. Sorry. Now, this is how we know the signs and symptoms of the lower limb ischemia. Now, how you can decide it? And by intermittent claudication, we say this is either according to the distance of the walk and the time to relieve, decided the obstruction, either it is a mild, moderate, or severe one. Now, this is how to know the severity. Now, the most important to know the site of occlusion of that artery before we do any investigation. This is only by taking the history and by doing a physical examination to detect the abnormality of the lower limb vascularity. To know the severity and the site of occlusion before do any intervention like angiogram or CT angio or DSA, digital subtraction angiogram. When we have an occlusion of the aortoiliac, this occlusion in the Y graft, and distally from the abdominal aorta to bifurcated of the both common iliac artery. The claudication, it will be in both buttocks, thighs, and calves muscles. And femoral and distal down, it will be in both limbs, it will be an absent. Maybe you have a bruise on abdominal iliac region, and also it is an impotence. This is what we call this one, Lariche syndrome. You should be remember this name. When I ask you what is the Lariche syndrome. What is the Lariche syndrome? Lariche syndrome, it is an impotence, and this is aortoiliac occlusion with the absence of fourth pulse, and this is occur in the male. You should be remember this name, Lariche, Lierches, Lariche. You should be remember this name. It is very important for the criteria of the Lariche syndrome. Second one, when we have an iliac obstruction, either left common iliac or right common iliac, here we have only unilateral claudication in the thigh and the calf, not in the buttock, always joint below. When you have an occlusion, it should be joint below, it will be occluded. The claudication in the thigh and the calf, the bruise may be over the iliac region, and there is a unilateral absence of the femoral and distal pulse. When you have a femoral popliteal occlusion, you have a unilateral claudication in the calf muscle, And the femoral, because it is pulse, it will be positive, and absent distally. And always joint below. Always joint below. Distal occlusion, the femoral and popliteal, it will be a positive and it will be absent in the posterior tibial artery, anterior tibial artery, and dorsalis pedis. And second one, you should be have what we do, an ankle pulse and absent. Ankle pulse absent. This is we have a claudication in the calf and the foot. The calf and the foot. The best result from surgery are obtained by operation on the large vessels, not on the small vessels. And this is ultimately the result that will be okay in the future, because the diameter of the artery is so large, so the patency, it will be prolongedly patent, which allow the high volume of the blood flow to the bypass graft. Like in the aortoiliac bypass, it is a long standing than femoral bypass. Yani the occlusion of the graft, it will be longer when we have more proximal than distal part of the artery. The investigation, as you remember, we have a general investigation, don't forget it, like any CSP, any complete blood count, and the blood urea, serum creatinine, and lipid profile, blood sugar, and we can do an ECG, an echo, chest X-ray, and abdominal X-ray, abdominal ultrasound, or abdominal and chest ultrasound with the plus a CT scan, MRI, either with angiogram, or we have either a CT angio or MRI angio. Specific one here, you should be put two things, what we call it important to complete the investigation of the lower limb vascularity problem. Lower limb vascularity, beside the claudication, the temperature, pre-gangrenous and gangrenous, and coldness and temperature and sensation involvement, all are, you should be remember it. And we have a Harvey sign, and we have venous refilling, capillary filling, and we have an impotence, and we know the site of artery, either it is abdominal aortic occlusion, or only iliac occlusion, or femoral occlusion, or femoral popliteal occlusion, or distal part occlusion. To know the severity, also the most important to complete your examination, this is what we have, a specific, what we call it, an ankle brachial pressure. How we do it, as we see in the diagram below, it is we put a sphygmomanometer on the brachial artery, and we do also sphygmomanometer on the ankle joint to measure the arterial pressure in both sides. And we have a ratio, it should be the ratio more than 0.9. more or 0.9، يعني لازم يكون عندك يعني بالانكل بريشر، اذا كان الدايستوليك السيستوليك بريشر 130، بالبريكيال 130، يقول لك it is a normal one or maybe above one. لكن ايش قد ما يقل الانكل ريجيو، الانكل بريكيال ريجيو، يعني عندك البريشر مالتك عندك 130 بالبريكيال، وهنا دي يوصل لك بالانكل 100، فتقسم 100 على 130 هتكون ايش قد البرسنتج مالتك. فالسيفيريتي is depend on the ratio. It should be have a mild when we have it is only below 0.9 إلى 0.8. Moderate start from 0.8 إلى 0.6. From below 6, it will be a more severe. What this we call it a critical lymph ischemia. What we mean by critical lymph ischemia, when we have, it is a time to decide. It will be end by amputation. side. This is end by amputation of the limb. This is what we call it a critical limb ischemia. It is when we have an ankle brachial ratio less than 0.6 to 0.4. Management always should be explanation and advise the patient to take care about the limb, especially skin and nail, and it should be have always change of the lifestyle. Always you should be encourage the patient to walk. Yes, even so he said, yes, doctor, when I walk I have a pain. Yes, told him it is okay. If it is a pain start after 1 week to more than 1 week to 3 weeks, when we walk for some distance, like 50 meters, we complaining of the pain. When you do an walking every day, maybe this 50 meter, it will have no pain after 3 weeks or 1 month. You should be increase the distance of the walking. This is, it will be encouraged to formation of collateral vascular about around the occluded artery. This is very important, the collateral artery. How it will be developed, collateral artery, it should be done by exercise and change life ستايل. يعني لا تخلي المريض دائما يقول لك والله انا احب اقعد ويتحجج لك مفاصلي او ظهري. Always you should be encouraged and exercise. The best exercise in the world, it is the walking. And you should be advise this patient to stop smoking, and you should be have a diet regimen and low salt and low fat, and also to control blood pressure by anti-hypertensive therapy. And besides that, it should be treated الهايبرغلايسيميا يعني to treat the sugar. Here it is very important يعني to take care about the feet, because it is always a problem of ischemia start in the toes and fingers. Always start because of the يعني capillary problem in this area. It will be more affected, especially if it is not take care about the hygiene of that part. And always you should be advised this patient to wear a high يعني high او هي ريست. يعني always الشوز مالته دائما تنصح المريض يقول كعب عالي. ليش تلبس كعب عالي؟ لانه لما تلبس الكعب العالي there is no muscle contraction on the calf, so it will be less pain when you are walking. This is an opposite in venous disease. بالفين عادة نقول له you should be wear a flat shoes. هنا تقول له you should be wear a high heel shoes. هنا كعب عالي، هناك كعب واطي. ليش؟ لأنه هناك لما تلبس الكعب العالي ما يصير عندك contraction to the calf muscles، بينما لما تلبس الفلات ما يصير عندك يعني compression على المسلز. فلذلك بالفينس always تقول له البس فلات حتى لما تخلي رجيناتك يصير compression على الكالف muscles حتى to retain back of the blood flow to the heart. always يعني تقول له ابو الارتري تقول له البس كعب عالي، ابو الفينس problem تقول له البس فلات. And you should give some medication for that one. The medication to improve blood flow to the obstructed part of the limb, like we use a vasodilator like the Praxilene, Trental, and the prostacyclin. This is it will be a vasodilator effect, and you should have control of lipid abnormality by decreasing blood body weight, and it should be decrease the fat intake, and it should be take agent that to reduce cholesterol and triglyceride. Diabetic also by decrease in body weight, decrease in intake of carbohydrate, and you should be either give an oral hypoglycemic or insulin according to the condition. الhypertension also the most important. It is a decrease in body weight and salt intake, and maybe you take a beta blocker or calcium blocker, channel antagonist. Analgesia is very important to relieve the pain and to encourage this pain to movement. And the position should be a burger position. Burger position, what we mean by burger position, it should be put, it should be put two things to elevate the head of the bed, and it should be the head up and leg down, and this is it will be encourage a blood flow go to the lower limbs, and he should be always do an exercise when he lay down on his bed, and do by elevating of the limb below the bed and above it. This is a good exercise for him to decrease the blood flow. And don't forget always to give an antiplatelet or anticoagulant to prevent any thrombotic at the site of obstruction, like aspirin, or we can give clopidogrel, or even we can give anticoagulant like a warfarin. Now, this is regarding the advice of the way change the lifestyle of that one, and prevent smoking and prevent alcoholic consumption, and encourage this patient for walk. And beside that, any medication that to control pain and hypertension, hyperlipidemia, hyperglycemia, and besides there's a vasodilatator and pain killer you should be given this patient, and you should be take care about the feet, and take care about to take and wear high heel shoes. Now, sometimes you need to do a sympathectomy. Sympathectomy. A sympathectomy, it is either a chemical one, or maybe a surgical. Chemical, we injected to the sympathetic chain a phenol injection at the site. Yeah, it should be do it under screening of the CT scan or ultrasound to localize the sympathetic one, or by do a surgical sympathectomy. This is to remove the sympathetic chain on L1, L2, L3, L4. When you do a bilaterally, you should be keep L1 on one side, to keep L1 on one side intact. Don't to cut it, because it will be affected of the erection, especially in the male. It will be affected erection. When you have an affected of the erection, the patient, he is complaining from that. He will forget the disease, and he catch you about the problem of impotence. Transmural angioplasty. Now it is more common they do it by intraluminal stent. Intraluminal stent, we can do it intraluminal stent, especially in the peripheral arterial disease, especially in the smaller size. It will be maybe a benefit to do an transmural angioplasty by stent, or sometimes we do an atherectomy. This is by use by using sometimes we call a thrombectomy. Thrombectomy is material instrument to remove of that atheroma from the inside. And now it is an angioscope, and sometimes used to enhancement with the stent and balloon dilatation to relieve of site of obstruction. If there is no facility to do, we can do an operation. This is the operation we do, an end arterectomy. And you remove the intima. remove the intima, or we can do a bypass graft. Bypass graft, يعني site of obstruction, we do anastomosis proximal to distal part of obstruction by using either savinous reverse vein. يعني عادة لما تاخذ الفين تخلي لك البروximal part يصير distal والدistal يصير proximal because it contain a valve. And always when we have يعني an acute stage, you should be use a contralateral side, not use an ipsilateral part. يعني لا تاخذ الفين مال اذا انت عندك بالاكيوت تروما لا تاخذ الفين of the same site، اخذ الكونترالاترال site. لكن بالكرونيك we can use the same vein of the affected part. It should be reverse يعني تخلي proximal distal والdistal proximal بالانستموسيس. How you can use a prosthetic material like Gore-Tex and Dacron. And sometimes we can do a femoral يعني اليوم عندي واحد من شرايين الفخذية مالتي مسدود، الشريان الفخذي بالأذر سايد طبيعي، أسوي لي بايباس جرافت، أسوي لي جرافت من النورمال femoral artery to the affected femoral artery. This is what we call femoral bypass. Sometimes we do an extra position. الاكسترا بوزيشن يعني انا اليوم عندي اليوم obstruction of the femoral artery obstruction. I can use an axillofemoral. انا اسوي لي انستموسيس، افتح على الاكسيلري ارتري، اخلي لي جرافت، وهذا الجرافت اخليه يمشي سبكوتينيوسلي الى ان يوصل الى حد الفيمورال to relieve the symptoms of the lower limb. This is, we call it extra anatomical one, axillofemoral graft. Always, as I mentioned before, the most important, the size of the artery we do the operation. It will be the result of operation. It will be depend on the size of the artery I do it. When you have an aortoiliac, it's very good. But a femoropopliteal, it is good 90% of the vein graft, but the start of failure after 18 months post-operative, and five years maybe, it will be lead only to 30 and 60% of this patient have a patency of that graft. يعني by the time maybe have occluded of the graft, I do it the graft by the time, because of the diameter when it is smaller, have more chance to occlude it again in the future. This is, I hope that you understood the atherosclerotic, which is a more common affected of all age of a group and gender, and not affected only a male or a female, it is also affected. Now it is not related between a gender, male and female, but the sign and symptoms, it will be different. If the male have impotence here and female have no impotence, the atherosclerotic affected both of them because both of them have hypertensive or hyperglycemic, and both of them may be a smoker, especially in this period. The female may be a smoker more than the male, and the obesity is another problem, and inert and not doing an exercise, it will be increase the problem of the vascularity. الارترايتس كل ITIS mean inflammatory process. The most important, it is in arthritis what we call the thromboanginitis obliterans. Thromboanginitis يعني التهاب الأوعية الدموية التخثري الانسدادي. التهاب الأوعية الدموية التخثري الانسدادي. thromboanginitis obliterans، أو we call it Berger disease. يعني إذا جاك سؤال بالامتحان باباتي, what is we mean by thromboanginitis obliterans? Mean it a Berger disease, or I mention a Berger disease, you should be know it. Second of type of arthritis, what we call the Takayasu arteriopathy. This is a Takayasu, a Japanese Zen doctor who discovered this one. And cystic Mixomatous degeneration. Besides, we have a vasospastic condition, which is a more common. You can find it in your life. This is what we call the Raynaud condition, acrocyanosis, or livedo arteritis, or frostbite children. Now, Berger disease, it is occlusive disease of the small and medium-sized artery. This is very important to remember. It's small and small, not a large size artery. It is affected the plantar, tibial, and radial artery. Thrombophlebitis may be affected beside the artery. It is also affected the superficial or even the deviance. Berger disease can affect the upper part. Yes, also it can affect the upper part. And more common, it is in the male. Now it is maybe unequal because previously the most important etiology of Berger disease, it is the smoking. Male, young age, it is 20 to 40 years. This is the age incidence of the Berger disease. Not occur in the female because non-smoker. This is a wrong. I think now it is the female more smoking than the male. It is more common in the Russian Jews. يعني اليهود الروس عندهم المور common of that Berger disease. شو يصير عندي بالبرجر disease? It is histological, lead to localized inflammatory change occur in the wall of the artery and the vein, lead to the thrombosis, and lead to the gangrene of the foot and fingers are common. This is the Berger, how it will be appear. To confirm your diagnosis, it should be taken history. And the male, young age, smoker, it will be affected more than non-affected non-smoker patient. And a crazy SR, you should do an coagulation screening and lipid profile. Besides, we can do an angiography, differential diagnosis of that one. Maybe have a pre-senile atherosclerosis or polyarteritis. Treatment of that one, the most important it is a stop smoking. Sympathectomy may be a benefit to relief of that pain, and if it is useless, maybe end by the amputation. يعني دائما عندي مقولة أقول للمريض الجقارة الوحدة تعادل إصبع، باكيت الجقار يعادل قدم، وتكة الجقار تعادل لمب كاملة. بدل ما أنت قاعد تنتهي only a toe amputation, maybe have a side amputation or maybe above knee amputation if you smoke or more. So either you choose the smoker or you choose your limb. Second important one of the arteritis, this is very important, a temporal artery or occipital artery and ophthalmic artery. These are maybe affected all arteritis. How it will be occur? This is a localized inflammatory process and it will be infiltrated with the giant cell and lead to the occlusion of the artery. A major complication of the temporal artery lead to the what we call irreversible blindness. هذا ينتهي بعمى دائمي. It's a serious things. How you confirm your diagnosis? It will be an increase in ESR, and you should took a biopsy of the artery, of temporal artery, at that one to confirm this is an temporal or occipital arteritis, and you should be treated by prednisolone. This is very important. It leads to the irreversible. يعني عمى دائمي. Another things of the arthritis, what we call the arteriopathy. This is a يعني Japanese doctor who found and discovered this type of artery. It leads to the obliteration artery, especially in female have a pulseless disease. Here you should be affected a narrowing obstruction of the major artery. البرجر artery كنا احتمال small and medium. This is a major artery, a big artery. هذا تخلي ايديناتك تشوف البلس الراديال pulse absent, the brachial artery absent, and femoral it will be absent, and the dorsalis pedis or posterior tibial it will be an absent pulse. What we call a pulseless disease, affecting a more common in the female. Treatment of that occlusion, we can do a bypass surgery to relieve of that site of obstruction. Also, I have another thing, what we call cystic mixomatous degeneration. This is due to the accumulation of the clear jelly-like synovial ganglion in the outer layer of the main artery. Because of the jelly-like formation affected outside of the artery, outside in the outer layer, يعني tonic adventitia of the artery, lead to the stiffness of the artery, compression of the artery, lead to the disappearance of the pulse, and maybe have a claudication. And you should be always diagnosed by the arteriography. It will be have by arteriography. You should be have a smooth narrowing due to the cystic lesion completed of the artery from the outside. Very important. It is a smooth narrowing بالangiogram. You should be remember this smooth narrowing. Treatment you should be do by an excision and bypass graft. The last one, it is a vasospastic Raynaud syndrome. It is a primary have an idiopathic Raynaud syndrome. We have either يعني previous we call it يعني primary and secondary syndrome. The primary it is an idiopathic يعني without any underlying etiological factor. We have till now we don't know the etiology of that one. It is affected always the young female, affected the upper limb more than the lower limb. يعني also can affect the lower limb, but it is more common in upper limb. But always have a normal pulsation. ولا شيء يجون عادة يعني جوزتهم يعني جزء من عندكم باباتي خواتكم أو أمهاتكم يشكون من هاي الأعراض باباتي حتى جزء من زميلاتكم يعني احتمالا يصير عندهم during winter time يعني عادة في أيام الشتاء أو when they use a cold water and the cold weather always what do they have an abnormal sensation to the cold lead to the blanching يعني تبدي رأسا الإيد تصفر وتبيض بعدين يصير incapable of finger to move ما تقدر تحرك أصابعها بعدين شوية يصير capillary dilated when it is a capillary dilated lead to the digital swallowing and become a dusky color and after that when relaxation become red يعني تبدي blanched dusky color and this dusky color return to the red one and this one accompany with the pain. Most important, accompany with the pain. Don't forget, accompany with the pain. Treatment always, you should be avoid الcold. يعني نقول له دائما يا البس لك جلوفز، البس لك تشوف واي جلوفز، يعني حتى الغسل ملابس او الغسل يعني الصحون مالتكم البسوا جلوفز واستعمل لك المي الدافي. زين avoid البulb and nail bed infection. اهم شيء تحاول لا يصير عندك يعني during nail cutting يعني لا يصير عندك بارونيكيا inflammatory infection of that fingers. And use always of calcium channel antagonist. تستعمل لك يعني الأدلات أو تستعمل لك النورفاسك. It will be help and relief of that pain. And if it is continue complaining of that one, we can do a sympathectomy, either cervical sympathectomy in upper limb, or we can do lumbar sympathectomy for the lower limb. Secondary, not a primary. Secondary rhino syndrome, previously we called rhino disease. Secondary mean etiological factor is not an idiopathic، يعني مو مجهول السبب. هنا اكو اسباب تسوي لي اياها. هذا شو يكون عندهم دولة؟ احتمال البرفرال فيزوسباستيك نتيجة الاثيروسكليروتيك، or we have thoracic outlet obstruction syndrome. Thoracic outlet obstruction syndrome, TOS. Or maybe we have scleroderma, or maybe we have a systemic lupus erythematosus, or maybe, as I mentioned, always about these patients who use pneumatic vibrating tools, maybe have يعني long time of use that one lead to this a problem. Or maybe a carpal tunnel syndrome. Always when we have this pain and swelling of that one, not to go like in the previous one, it should be treated by underlying cause and calcium channel blockers, steroid and vasodilatation. A contraindication to do a sympathectomy. Remember that. In primary, you can do sympathectomy. In secondary, rhinoid, contraindication for sympathectomy. Remember this. Babati, remember, the primary, we can do sympathectomy. The secondary rhinoid, the contraindication to do a sympathectomy. Another things what we call the acrocyanosis. Acro معناته اللمس. Cyanosis استرقاق الأطراف. This is like rhinoid، لكن يختلف من الراينود. هناك ذاك painful هنا non painful painless not paroxysmal، يعني مو يجيك فترات هذا continuous. يصير عندك الأكروسيانوسيس. Affected also young female. يصير عندك cyanotic finger and paresthesia, and this should be treated by sympathectomy. الليفيدو ريتيكولاريس، ليفيدو يعني كل الجسم. ذاك acrocyanosis only اللمس. هنا الليفيدو ريتيكولاريس يعني it will be affected type of angiospastic affected all part of the body, have discoloration of the limbs, chest, when it is exposure to the coldness, and should be treated by warmness of that part. It lead to the disappear of that one. هذا it will be also a painless like acrocyanosis. Acrocyanosis only affected the limbs. Here livido reticularis affected all part of the body. Last one, we have in this what we call it vasospastic, what we call it the frostbite or chilblain. أكيد انتوا هواي تسلقون وتصعدون، يعني تسلق بالجليد وكثرة موجود ما شاء الله عندنا الجليد في بغداد. زين، فشو يصير عندكم لما تسلقون الجبال إن شاء الله إذا صعدتوا في المناطق النورث بول؟ يعني عندك it should be have always have a 4 stage of that frostbite or discipline. Either it will be start of a minor one, only have a cyanosis, it will be reversible by warmness of that limb, like in يعني in rhinoid, primary rhinoid one. When it is more exposure to the coldness lead to the secondary degree. Second degree, this is involve skin and subcutaneous tissue. It will be a very painful, but still fortunately it is also reversible to return to the normal one by warmness, and you can give a calcium channel blocker antagonist and vasodilatation. It will be relief of that problem. When the start of the ulceration of the skin, third stage, it should be admission to the hospital, and it should be a management of that one. Maybe you need a skin graft to prevent any future complication of contracture or abnormality of movement of that part. Fourth stage, unfortunately, when established of gangrene, it will be your result. It will be hopeless and need amputation. Another entity we have in the vascular disease, what we call it arteriovascular disease, the arteriovenous fistula. This is a communication between an artery and vein or veins, either congenital or acquired. Acquired, how it occurs, either by penetrating injury or iatrogenic. We do it in hemodialysis with chronic renal failure, or we creation dialysis. iatrogenic يعني during it تشتغل وصار عندك traumatic one especially بالcardiac catheterization بدل ما تدخل للفين تضرب الفين والارتري during this one. Both of them are structural. شو يصير عندك بالفستولة؟ انت عندك هذا high side of blood pressure, this is a low side of blood pressure. It will be returned back of the blood, arterial one, the high pressure to the lower pressure vein. It leads to the dilated of this vein and become tortuous, and thick wall become arterized vein. The physiological effect has structural effect on the vein. Because of short circle of the artery, it will be returned back the flow to the heart, lead to high pressure in the proximal and low pressure in the distal one, maybe lead to the distal ischemic limb, but return back all the blood pressure to the heart. The volume of the pressure, return to the heart is more, maybe lead to the heart failure. So an increase venous pressure, pulse pressure is high, increase the heart rate, and increase cardiac output lead to the left ventricular hypertrophy, and later on lead to the heart failure. Congenital one شو نفرق عن الأكوارد باباتي is very important. لما يكون الكونجيتال already يعني from the congenital, and young maybe have an upper يعني affected only one part, you can see an overgrowth of the limb. تلقى ايد واحدة من أطول من الثانية ذا only limb, or ذا بالlower limb have a leg, indolent ulceration and relative ischemia below the short circle. هنا لما يكون عندك الارتري مرتبط ويا الفين الدستالي ما يكون عندك اسكيميا little ischemia, لكن دول ما يصير عندهم heart failure. ليش؟ already because adapted of the blood return back to the heart. I have very important things to remember it, انه يكون below short circle little ischemia and no heart failure. Clinical feature of that one, it will be pulsatile swelling of the superficial vein. It thrill dilated vein, rapid blood flow pressure in the proximal artery, leading to diminish in the size and thrill. This is what we call it Branham's sign. يعني وان تضغط على المكان الفيستولا it will be disappear the bruit. disappear the bruit. يعني شلون تضغط على مكان وتسمع انه وين تختفي البروي، معناتها هذا site of the fistula. This is what we call the Branham's sign. How you can investigate it? By arteriography, treatment by embolization, or maybe need an excision, and severe deformity and recurrent hemorrhage may be unfortunately lead to the amputation. This is how we can do the site of fistula, and this is the vein and the artery, how it will be appear in the future. Hemangioma, another things, hemangioma, it is a benign tumor of newly formed blood vessels. We have three types of hemangioma. Capillary one, different from the cavernous hemangioma. When you press on the hemangioma, they will not collapse and not disappear. This is we see it on the left side. هذا دائما تقول لك، يشوف الطفل يقول لك هذا عنده وحمة موجودة، هذا لما تضغط عليه ما تختفي. هذا we call it capillary hemangioma. Maybe it disappear in the age of 8 or 10. If it is not disappear in the future, may be treated by the laser therapy. Cavernous hemangioma, when you are pressed, it will be an empty. This is, we call it the cavernous, that we see it in the middle picture. This is, it will be need either embolization or we need a surgical excision, but I always do a surgery for them. Combined it is, and excision is the best way when you have a capillary and have a venous hemangioma. Treated always is better by the surgery. Either, and we can do also by injecting sclerotherapy agent. We can do it, but always I prefer to do a surgery for them. If it is small and ugly shape for cosmetic purpose, I will do a surgery for them. If it is a huge and not important, the cosmetic one you can do by injection or by embolization. Thank you. I hope that it is long time of lectures. I hope that it will be needed in your future, how to diagnose the problem in the cardiac surgery or in the vascular surgery, and how you deal with them. At least we have a basic sign to deal with them. Thank you very much for your interesting, and thank you for your attending my lectures, and goodbye. I hope that it will be you succeed in examination. Thank you very much.